Thank you, everybody, for rejoining me. I'm so glad you've heard something about health finance. And over the 2 days, I think we heard every concern from every patient group and health professional. And we also saw great inspirational messages for us to go forward and change our way we work and way we deal with our collective difficulties. I think if we have to sustain our healthcare systems in this great impact that COVID has delivered us, it's a body blow that we have to recover from. One of the methodologies I came across from South Korea was when I met Ji Jong way back about 5 years ago, and from the Korean Alliance of Patients Organizations. And they had started a methodology of getting to the nub of issues that patients were having by organizing what is called a Patient Shouting Café. The cafe invites patients who have issues and gives them 5 minutes to talk about these issues clearly in full earshot of health professionals and those who are working with us, making sure the health professionals understand. And at the same time, they have support from counselors and doctors, and also we've got health policy workers and lawyers as well sitting in that hearing. And whatever is being said to them, whatever's been told is then taken back and referred to, and then the patient gets the adequate advice that they need, and we lead forward from there onwards. So without further ado, I will ask Jijong and guys to start the 5 selected patient shouting sessions that we have recorded and have looked at. It's very late up in Korea, and I'm glad he's up and joining us. Thank you, production. Can you start the videos?
일단 저기 원무과에 가서 돈을 내야지 응급처치를 해줘. 그런 것도 불만이고 이렇게 병원에 가서 이렇게 말을 하려고 됐어요. 누가 책임져야 합니까?
택배 물건처럼.
비싼 약이기 때문에 지금 보상을 안 하겠다는 거냐.
당신 같은 거 하는 데 필요 없어. 나가!
The cafe has become an arena for Korean patients who are fighting to protect their rights against hospital, pharmacies, pharmaceutical companies, the government, and local administrations. The patients have started the Patient Shouting Café as a hub for open communication in the medical and healthcare field. Here the patients shout out their troubles and complaints, find healing in consolation and sympathy from the audience, and seek wisdom for finding solutions to their problems. The patients are free to pour out their hearts about their sufferings, complaints, and wrongdoings committed by various stakeholders.
우리 예강이가 어떻게 자기가 죽게 되었는지 원인이라도 알고 또 다른 예강이 같은 피해자가 없도록.
문제는 이 약이 한 알에 16만 7,500원이래요. 하루에 2알을 먹어야 되는데 그러면 한 달에 약값이 1,000만 원이에요. 약이 뭐 잘 들어도 걱정, 안 들어도 걱정이에요. 잘 들어줘도 막상 또 처방받으려면 한숨만 나오고 돈 때문에, 약값 때문에 치료 못 받는 게 진짜 너무 서글프고 이게 누구를 위한 약인지.
정말 사소한 실수로 주사기를 잘못 잡는 그 실수로 아깝게 목숨을 잃는 경우가 없었으면 좋겠고요. 그 희생으로 미흡한 제도가 제발 고쳐졌으면 좋겠습니다. 그래서 앞으로 치료받아야 할 우리가 좀 더 안전한 세상에서 살았으면 좋겠습니다. 직업이 기자라면 기사로서 써주시고요. 의사라면 의술과 정직한 양심으로 치료를 해주시고요. 정부라면 정책으로 각자의 자리에서 자신의 사명으로 용기 내서 세상을 바꿔주셨으면 좋겠습니다.
There's an advisory committee that consists of medical doctors, lawyers, and patient group representatives, and it suggests solutions to the issues raised by the patients at the cafe. Following these suggestions, the patients try to seek solutions together with KAPO. At the Patient Shouting Café, the patients find tremendous comforts and healings in empathy and support from the audience. Journalists also take part to report on the medical and healthcare agenda discussed at the Patient Shouting Café. This forms public opinion, thus leading to the making of important regulations, policies, and laws. We were able to learn that patients can have their voices heard through the Patient Shouting Café to become an important healthcare public agenda. When patients and patient groups participate in the process, healthcare regulations, policies, and laws can be changed to become more patient-centered.
Thank you very much, Jijong, and all your staff and patients who took part. I visited South Korea and had such a lovely time seeing what they were doing. And I think at the Global Patients Congress, we have had a session for them always. They're deep in our heart. And I think this methodology is now very apt for this time because we need it more than ever, because we will have to shout for our case when economies are slowing down. I will now ask our own member organizations, 3 of them who have now given us an insight into it. And I would welcome all our members. We selected from hundreds. I think it was 3 that it was a very difficult choice to come up with the 3. And I hope you like this next group of patients who are shouting for the issues. And each has a unique viewpoint and each brings a new issue to the forefront. And let's hope we can use this methodology in the near future. Thank you, production. Next one, please.
안녕하십니까. 저는 김재윤 어린이 엄마입니다. 재윤이는 지금 3년 전에 세상을 떠났는데요. 당시에 3년 동안 항암 치료를 받고 있는 과정 중에 있었습니다. 치료 종결을 넉 달 정도 남겨놓고 재윤이는 골수검사를 받게 됐습니다. 소아는 골수검사를 받을 때 수면제를 맞고 잠든 상태에서 봤는데 재윤이가 그날 컨디션이 많이 좋지 않았습니다. 열도 나고 이제 만 3년 동안 항암 치료를 받아오다 보니까 많이 쇠약해진 상태였고 어지럽고 구토도 하고 많이 처져 있는 상태였습니다. 제가 의사 선생님한테 재윤이를 잘 관찰해 달라고 말씀을 드렸고 그리고 바로 재윤이는 수면제 3가지의 수면제를 4대 맞았습니다. 10분 안에 모든 약이 다 들어갔고 재윤이는 곧 깊은 잠에 빠졌고 그리고 잠이 든 상태에서 골수검사가 다 진행이 됐고요. 수면제를 맞은 지 10분 만에 검사를 끝내고 아이를 돌려보니까 이미 재윤이는 숨을 쉬지 않고 있었습니다. 심장도 멈춰 있었고 숨도 안 쉬고 있었고 환자 얼굴을 아무도 보지 않고 있었기 때문에 검사가 끝날 때까지 환자가 숨을 쉬고 있지 않다는 것을 아무도 알지 못했습니다. 환자 컨디션 체크하는 산소 포화도 체크하는 기계도 무음으로 되어 있었고 해서 재윤이는 발견 당시에 심정지가 온 지 5분 이상이 경과했을 거라는 부검의 소견이 있었습니다. 그리고 나서 재윤이는 응급처치를 신속하게 받지 못했고 몇 분이 지나서야 응급처치를 받게 되었는데 1차적으로 심장이 잠시 뛰었지만 그날 밤 12시 30분 검사 받은 날 당일날 숨을 거두게 됐습니다. 그래서 제가 생각하는 문제점은 수면제를 단시간에 많이 놓으면서 아무도 환자를 관찰하지 않았습니다. 작고 약한 어린이에게 수면 진정을 시행하면서 환자 관찰을 아무도 하지 않았습니다. 다 거기 검사할 때 검사자와 관찰자 한 명이 있었지만 모두 검사에 집중하는 바람에 환자 얼굴은 아무도 보지 못했다고 했습니다. 재윤이는 환자 안전에 대해서 전혀 고려하지 않는 환경에서 진정제를 맞고 검사를 받고 또한 12시간 뒤에 사망까지 이르는 과정에서 재윤이에 대해서 치료나 검사하는 과정에 대해서 안전을 전혀 보장받지 못했습니다. 재윤이는 고난이도의 시술이나 치료를 받다가 사고를 당한 것이 아닙니다. 소아 진정은 지금 소아 치료에서 널리 쓰이는 방식인데 그 소아 진정을 시행함에 있어서 만일에 하나라도 사고가 날 경우를 대비해서 응급처치나 환자 관찰이 철저하게 이루어져야 된다고 생각합니다. 사고는 한순간이지만 재윤이는 하나뿐인 목숨을 잃었고 가족의 품으로 다시 돌아올 수 없고 남아있는 가족들은 평생 재윤이를 그리워하면서 살아야 합니다. 치료진이 조금만 더 환자 안전에 대해서 고려하고 잘 관찰하고 현재 환자가 치료받고 있는 환경이 안전한지, 검사받고 있는 환경이 안전한지, 환자 컨디션은 어떤지 조금만 더 관심을 기울여 준다면 환자는 생명까지 위협받지 않는다고 생각합니다. 재윤이의 작은 목숨을 통해서 좀 더 다른 환자들이 진정 치료를 받을 때 좀 더 안전하게 무사히 치료를 잘 받기를, 그런 장치가 마련되기를, 좀 더 안전한 환경이 되기를 바라는 마음에서 재윤이의 죽음을 알리고 있습니다. 저는 재윤이가 분명히 메시지를 저한테 중요한 메시지를 주고 갔다고 생각합니다. 그냥 사고를 당해서 죽은 것이 아니라 지금 왜 죽었는지, 무엇 때문에 죽었는지, 어떤 이유로 죽었는지 우리가 한 번 더 생각하고 그 부분을 잘 살펴서 다른 사람들의 목숨을 한 명이라도 더 안전하게 구할 수 있다면 그것이 재윤이가 제게 주고 간 말이라고 생각합니다. 감사합니다.
Growing up in the small island of Mauritius, I received the unexpected diagnosis of lupus at the very young age of 13. The journey that follows was an arduous one filled with perseverance and survival. During these past 22 years, I have been overwhelmed with feelings of hopelessness. Prior to my diagnosis, I was a teenager full of life who was doing quite well at school, learning ballet, piano, and participating in various other activities, sport activities, for example. I think the hardest aspect of having lupus as a team is the inevitable sense of isolation from the normal world. Living with lupus is challenging and disturbing from the very moment of the diagnosis. There were times when my condition did not allow me to attend, or the pain and other physical restriction prevented me from participating in school activities and even school attendance. I felt frightened, angry, depressed. But with the support of my mother, I soon realized that living a life paralyzed with fear was not living at all. So I gradually had to accommodate my life to this dreadful disease. I had to adjust to the impact of strong daily medication and learn how to resolve stress, pain, depression, and fatigue. It actually took me 2 or 3 years to get that grips of lupus. But my grasp was strengthened by the contact with other people who have the disease. I also learned that by being open with friends, teachers, colleagues, co-sufferers, and health professionals helped me to cope with the disease and has helped me reduce these feelings of isolation and desperation. Life with lupus is a journey. Throughout the years, I found out that sharing my story has also helped other patients. So therefore, I actually made this my priority to educate others and raise consciousness about lupus and other autoimmune diseases. As a patient who represents the gender likely to develop lupus, I am now the spokesperson generating awareness around the island of Mauritius. Passionate about this awareness, my goal has been to ensure that all the work achieved ultimately benefit every individual affected by lupus. I strive to raise awareness across the country, but also in the Indian Ocean. In 2020, together with my mother, Babs, I founded the Lupus Alert organization, which is a non-profit organization in Mauritius, and which provide moral, emotional, and financial support to people living with lupus. Our goal is actually to provide lupus education to teachers, friends, family members, and even health and government professionals who are not aware of the symptoms of lupus and its complication. So together we have, as an organization, we focus on the need for improved healthcare services, increase research into the causes and cure for lupus, enhance physician diagnosis and treatment of lupus, and obviously better epidemiological data on lupus globally. When I came out in 1999, about my disease, when I came out public with my suffering and traumatic experiences and agony, lupus was actually unheard in Mauritius. So the impact, awareness, education, understanding, clinical support, research, pain, frustration, and many more terms are what I have learned when engaging in this lupus battle. Lupus awareness in Mauritius has become, like I said before, a passion for me. All the work achieved has actually touched every individual in Mauritius, every individual impacted by lupus. For me personally, I always encourage other patients to accept and talk openly about their illness. Because for me, by providing this network of support, it has helped them to manage and cope with lupus. We have been able to improve the quality of life of the patients. By raising my voice and throughout my work as a campaigner in Mauritius, I have put the disease on the map in this country, in the Indian Ocean, but also on the continent in Africa. This has actually strengthened the links between the different islands of the regions, the African neighboring countries, and obviously Mauritius. So now we are connected and we can share our experiences. This quest and endeavor to relieve the suffering of others has given me strength to overcome my feeling of hopelessness and helplessness. So compassion has brought me invaluable profits, which cannot be estimated in cash or in personal growth, but in learning to know myself and others. Like I said, I've been joining other lupus advocates around the world who are calling for governments to increase their financial support for lupus research. What we need now is more lupus research. Each year on World Lupus Day, we as a lupus organization around the world call for the increase in public and private sector funding for medical research on lupus, targeted education program for health professionals and patients and the public in general, and obviously worldwide recognition of lupus as a significant public health issue. Because at the moment, the big problem is that the people are still innately ignorant, and the misconception on the lupus are no different than the stereotypes of people. There are certainly a lot to be done as regard to lupus and other autoimmune diseases in Mauritius, but also in the African region. And the absence of data on the epidemiology of lupus in Mauritius is the cruel factor for me, with which we struggle at the moment, which I struggle, because if I have this information, we can reach out to more patients. So for me, with research advances and for a better understanding of lupus, the prognosis of lupus, with the advanced research and better understanding of lupus, the prognosis for people living with lupus today is far brighter than it was 20 years ago. But the quality of life needs to improve. So my goal really is to bring down those barriers that have impeded in the progress of in lupus research in Mauritius. As the current research efforts unfold, there is obviously continued hope for new treatment, improvement of quality of life, and ultimately a way to prevent or cure the disease. Now, this research effort of today may definitely yield the answers of tomorrow.
So I'm Flavia Chomkama. I'm the Executive Director of Action Group for Health, Human Rights, and HIV and AIDS in Uganda. And I'd like to share my personal experience with our health system and the health service delivery in Uganda, particularly during the corona crisis lockdown that took place in May and June. It took up about 90 days. So during the crisis and lockdown, I had a niece who was pregnant, and we were to take her to the National Referral Hospital, which is about 10 kilometers away. By that time, there was no way to move unless you had a pass, travel pass from the Residence District Commissioner, who was in charge of allowing anyone to move in and out of their homes, and also even for medical emergencies. I went to the Residence District Commissioner to seek approval, and it took me like 2 days to take my niece to hospital. She was for cesarean section because her first delivery, she had been operated upon, and therefore she did require to go in time and have a cesarean section. So when I went, I got the approval like after 2 days. Lucky enough, she hadn't yet got in labor. We went to the hospital, and the line is so long. And like in the next 6 hours on that day, her labor started setting in. Remember, she's supposed to be for cesarean section. So we pleaded with doctor after doctor to have my niece attended to. But each doctor would let us know that we shall be the next in the queue. But the next became a nightmare, as even those that didn't seem to be emergencies or who were finding us there continued to replace my niece off the list of the queue that had been developed. So we did realize that there was kind of discussion between the support staff and some cleaners. So we consulted from the carers what happened, why were people who were just coming being whisked off, and yet my daughter was now in full labor, and yet she was supposed to be operated upon. And of course, this would push grave danger to her. So we were told we had to pay some little money to the support staff to pay the doctor so that she's taken to theater. So we gave this cleaner an equivalent of about $35. And we were told to wait still. I think there are those who are paying more, but we were told to wait. We spent another 18 hours in on the waiting list, and eventually she was called in at 9 p.m. on the third night, having spent 2 days in labor. So to be precise, we went to hospital on Thursday morning, and she was operated upon on Friday evening at 9 p.m. She was back from theater around midnight. So there is a huge number of women seeking maternal and neonatal services at this center, and therefore to get on their list, one has to buy their way through, especially if it involves going to theater. Normal deliveries, somehow women get delivered. But if it's going to theater, it's a big hassle. There are few doctors who are operating, and I think there are also few theaters compared to the number of people who are needed. The commodities themselves are not available. So we had to pay for those ones to be able to have my daughter attended to. If you don't have those, the cotton, the gloves, the whatever, no one will allow you to go to be taken in. The jig to clean your bed, you know. But it is also worth noting that there's a lot of corruption in our health centers. It is so despicable. And I think it emanates from mainly the poor paid by government to the health workers. And of course, it's only a few higher positions that are being paid well. And to make matters worse, the staffing is suboptimal. Therefore, people get tired. So for them to be able to work on you, you must be able to show that you have something in your pocket that they can also use to clear their burnout off their heads and come and work on you. So I really felt frustrated, depressed over the trends of even starting with accessing the RDC's office to get CAPAs, to finally getting my niece in theater. I think it was all by the grace of God that she survived. Several died. And on a daily basis, we have 16 women dying in labor. You know, I felt like a prisoner in my country. And to make matters worse, our stay in hospital with the woman in labor almost drained me out of all hope and life. I felt that our government, despite that the ruling party has been here for 33 years, has not done much improvement in maternal health services and has betrayed us, the poor. The poor continue to be driven further into poverty with all the poverty and the voicelessness that we can see right now. So what would I wish to see is that we advocate for more health workers so that we have more health workers at the disposal of any mother in a hospital. We ought definitely as communities to challenge corruption that has eaten the last fabric in our households and institutions, especially in health. We should also advocate for increased staffing and pay for the staff. But above all, government must come to it to do its duty of providing commodities for people who come into health centers. And I think what we can do as communities, as Action Group for Health Human Rights, is to continue to conduct our regular community social accountability and monitoring activities to ensure that communities know their rights and also demand that services are provided and the services are of quality. But above all, we shall continue to work with the teams, work with the members of IAPO and other civil society organizations to budget, to advocate for increased budgetary allocations for sexual reproductive health, especially maternal health services. And this we have been doing in engaging the Ministry of Health, but also engaging Parliament and also consulting with communities to ensure that we have the best services available.
Hello everyone, I am Ki Jong-an, the representative of Korea Alliance of Patient Organization, KAPO. I have been involved in patient advocacy activity since 2005 when my wife was struggling against leukemia and I was suffering from thyroid cancer. 지금부터는 한국말로 이야기하겠습니다. 저희 한국환자단체연합회는 아파도 걱정 없는 세상을 만들기 위해서 질병, 이념, 국경을 넘어 환자들의 투병 환경 개선, 권익, 복지 정진을 위해 모인 환자단체들의 연대체입니다. 2010년도에 창립되어졌고 현재 8개 환자단체 52,000명의 환자들이 참여하고 있습니다. 저희 환자단체연합회에서 오프닝 영상에서 봤던 환자 샤우팅 카페를 시작했습니다. 오늘 환자와 환자 가족 3명이 샤우팅을 했습니다. 첫 번째 그 아프리카 모리셔스에서 루푸스 투병을 하고 있는 달릴라의 샤우팅을 참 감명 있게 들었습니다. 그 루푸스 진단을 받고 그 투병하는 동안 자기가 겪었던 그 어려움을 이제 다른 이제 루푸스 환자들이 좀 더 투병을 잘할 수 있도록 하기 위해서 그 루푸스 교육을 그리고 그 루푸스에 대한 잘못된 이제 인식을 바꾸는 활동도 하고 특히 이 정부의 루푸스 연구에 대한 이제 관심을 높이고 그다음에 재정 지원을 할 수 있도록 계속 요구하고 있다는 그런 샤우팅을 들었는데 되게 좀 감동적이었습니다. 왜냐하면 누구보다 이제 환자이기 때문에 루푸스 환자의 그 어려움을 너무 잘 알고 있고 그래서 가장 필요한 게 뭐냐 이제 교육과 인식 전환과 특히 이제 루푸스에 대한 연구가 필요하다. 그래서 정부가 재정 지원을 했으면 좋겠다고 했는데 사실은 좀 쉽지 않을 수가 있잖아요. 제가 좀 제안하고 싶은 거는 루푸스 연구는 그 모리셔스에서는 아주 활발하지 않을지 모르겠지만 해외 다른 나라에서는 굉장히 활발하게 이루어지고 있거든요. 그래서 교육 관련 컨텐츠나 또 연구 관련 컨텐츠들은 해외에 있는 환자단체나 연구기관에서 좀 받을 수 있을 것 같아서 그래, 뭐 야포를 통해서 좀 이렇게 도움을 받는 것도 가능할 것 같고요. 두 번째 샤우팅을 한 우간다 HIV 그 환우의 플라비아의 그 조카의 샤우팅을 들으면서 너무 안타까운 마음이 들었습니다. 왜냐하면 그 이제 그 플라비아의 조카가 이제 제왕절개로 이제 출산을 해야 되는 그런 긴급한 상황이었는데도 불구하고 병원을 찾지 못해서 이틀 동안 병원을 좀 찾아 헤맸고 결국은 다른 도시에 있는 병원에 가서 그것도 빨리 치료가 안 돼서 그 병원 직원에게 돈을 사례비를 주고 치료를 받았다는 그 상황을 들으면서 너무 안타까운 마음이 들었습니다. 왜냐하면 그 의료에 있어서 가장 그 기본이 그 출산이거든요. 특히 이제 제왕절개든 그럼 자연분만이든 출산에 있어만큼은 가장 기본적인 의료인데도 불구하고 그게 우간다에서 제대로 제공되지 않는다는 게 너무 안타까웠고 이건 어떻게 솔루션을 줄 수가 없는 것 같습니다. 우간다가 적어도 필수 의료 영역에 대해서도 관심을 갖고 그리고 적어도 출산에 있어만큼은 좀 제대로 의료 서비스가 제공될 수 있도록 해야 될 것 같고요. 세 번째는 그 한국의 그 6살 그 백혈병 투병 중인 김재훈 어린이의 그 어머니 허희정 씨가 이제 샤우팅을 했습니다. 저도 이제 한국에서 활동하고 있다 보니까 이 사건을 잘 알고 있는데 너무 안타깝고 그리고 그 재훈이 어머니 너무나 대단하다는 생각을 많이 듣고 있거든요. 왜냐하면 재훈이가 비록 억울하게 안타깝게 백혈병 투병하다 그 완치 직전에 결국은 이제 골수 검사를 받다가 안전 장비가 갖춰지지 않은 곳에서 그리고 그 의료진이 재훈이를 그 수면 마취된 재훈이를 제대로 관찰하지 않은 것 때문에 결국은 사망한 일이 발생했는데 재훈이 어머님은 여기서 그치지 않고 제2, 제3의 재훈이가 발생하지 않도록 사실 법도 만들어 달라고 했고요. 가이드라인도 개정해 달라고 이렇게 했거든요. 그래서 사실 한국에서는 이제 가이드라인도 만들어졌고 법도 만들어졌거든요. 근데 중요한 게 뭐냐? 가이드라인과 법이 있다고 되는 건 아니더라고요. 결과적으로는 이 의료진이 특히 소아의 수면 마취, 수면 진정을 할 때 더 안전에 유의하고 그리고 더 세밀하게 관찰해야 된다는 이 기본적인 환자 안전의 원칙을 지켜야 되는데 그게 아직 습관화가 잘 안 되는 것 같더라고요. 결국은 이거는 제도나 법이 해결해 줄 것이 아니라 의료진이 더 적극적으로 환자 안전에 관심을 갖고 또 환자나 환자 가족이 또 환자 안전에 참여하는 것으로 해결할 수 있을 것 같습니다. 그 3명의 이제 환자 샤우팅을 들었는데 결국 다양한 얘기지만 결과적으로는 의료에 있어 가지고 하나의 또 주체인 환자 그리고 환자 가족이 환자 안전에 투병에 얼마나 참여하고 또 얼마나 이제 노력하냐에 따라 가지고 환자의 치료가 달라질 수 있다는 걸 보여주는 것 같아서 좀 의미 있는 샤우팅이었다고 생각합니다.
Thank you very much, Jijong, and everybody who participated in this. I'm sure everybody will agree that this is a great methodology. I think Jijong put it quite clearly that your voice does count, even if it changes the heart or mind of one health physician to change their behavior, it has made an impact. But your voice can go further, and in fact, it can influence a whole body of medical professions, like the anesthetics, pediatricians, and doctors and nurses, the whole body, to change their viewpoint on some issues, and they change the guidelines so they can bring on these guidelines. And if your voice is even louder, you get more people behind you, you're able to change that very big policy instrument. It's called a sharp instrument, and that's the legislation of a country. That legislation can put your case and your issue that you're addressing clearly solved. I think the law will impact everybody in your country, and really thank you for that. And today, I would like to conclude that for the last 2 days, we have heard many things. We have heard from great hope vaccination is coming. We heard about regulatory changes that we need to make. We have a wish list, and I think we have huge things to do. And then Joseph could see and put it, how much it may cost us. We may have to dig deeper into our pockets for the taxes and revenues and come together. But what is clear from Jijong and now is that it's time we all got together into one voice, and maybe let's bring about that global treaty we have been looking for. For years, they've been talking about the global health treaty that needs to come in and come after the tobacco treaty. I think the time is right for a global health treaty to influence things and change things. And if our voice is loud enough, then every of those 194 member states and the WHO will buy into it. And thank you for staying on. And now we will go on to the closing ceremony. We will finish off with wrapping of the day. And I'll see you across there. And thank you very much, everybody. And please, let's finish off on a high note and see what's happened and make a resolution. And let's make up a great, thank you those who have helped us in the overall consultation call to action. And let's announce the results of that, and also some of the points that we have made, and our annual grant winners for this COVID-19. Thank you very much, and I'll see you across.